Hi, Dr. Pulling. How are you today?
Very well. How are you?
Good. Thank you for having me.
Absolutely.
Here's a copy of my resume.
Thank you.
If you need to look that over.
Excellent. Yeah, we'll come back to this. Okay. So, Dr. George, can you tell me a little bit about yourself?
Yeah. So I just recently completed my DPT at Ithaca College in 2016. Sat the boards in October.
Mm-hmm.
With that, I was able to complete 4 different internship opportunities, one of which being just a kind of standard outpatient ortho.
Mm-hmm.
Another one being inpatient acute,
Okay.
kind of a hospital type setting, just like
Right.
this.
Right.
One pediatric rotation, which
Mhm.
I think is pretty applicable to the situation, and then actually got to work with the U.S. rowing team in a sports rotation for 12 weeks on my last one. Which was
Excellent.
very interesting.
Very cool. Can you tell me a little bit about why you're interested in this position?
What really kind of drew me to this hospital in particular is number one, it's about just under 200 bed hospital, so it's big, but it's not overly big.
Right.
And they really have a big emphasis on a nonprofit standpoint, so we can kind of focus the care on the patient rather than the bottom line of the company. And it just so happens while I was looking on the website, you guys also received 2015 one of the top places to work in the Northeast, so that obviously drew me towards looking at this position for sure.
Very good. All right. Can you tell me some of your strengths and weaknesses?
Yeah, I think some of my strengths come from kind of a team-oriented approach. I was on the rowing team in college, so that was a big kind of stepping off point to learn to work with other people.
Yeah.
And as well be very, very dynamic and flexible, kind of
Yeah.
being able to roll with the punches.
Mm-hmm.
When you're dealing with 30 different people, much like we have about 30 therapists here, you got to be ready for anything.
Absolutely.
I definitely think another kind of strength that I kind of benefit from is the accountability portion. I like to think that I'm always kind of on time and ready to go and have a real big commitment to the quality of care rather than how quickly we get them in or out.
That's very important.
I think some of my weaknesses to kind of go off that as well is a lot of times I think I'm too ready to care for my patients in the sense that I need to learn when to push them just a little bit harder.
Okay.
There's a fine line with children, so definitely kind of honing that skill.
Yeah, absolutely.
And another one I think is kind of confrontation has always been a little bit of a difficult point. That's something I can work on, and I definitely want to work on. But as of now, something I need
Always a
to work on.
challenge. Okay. Well, where do you see yourself in 3 to 5 years?
Just by the sound of this company, I really want to stay on board for a while. So 3 to 5 years, I'm hoping to work my way up statistically towards the top therapist in kind of the department, and definitely working towards a pediatric certification, really kind of specializing my treatment to the patient population for sure.
Excellent. Okay. Well, why don't you tell me about a challenging situation you've had with a patient or a staff member in your past experience?
Yeah, and this kind of goes back to being dynamic and kind of being flexible. A lot of times on my first rotation, we had a lot of, difficulty finding places where we could improve the company. A lot of times my kind of CI and I would not necessarily see eye to eye, but the good thing is that we were able to learn and kind of grow from being able to talk in a civil manner and not really fighting about stuff. So I even suggested, how about once a week we kind of meet up and figure out what we can do that week to make the clinic better. And I think by the end of it, it actually did help a lot.
That's excellent. Okay. Well, are there any particular types of patients you like to work with?
Yeah. Obviously, innately, I like working with the pediatric population, but within that, kind of the mid-range, kind of 8 to 14, 16-year-olds that are kind of sport-related. I enjoy their kind of motivation to get back in the game and really work hard and be committed towards therapy. That makes me work a little bit harder knowing that they're putting in the time and the effort, and I should be putting in just the same for them.
Excellent. Excellent. Do you have any questions for me?
Yeah. Over the course of the time here, what are kind of the opportunities to get continuing education? want to get pediatrics.
Yeah, absolutely. Well, we certainly value continuing education, particularly in this area of specialty, and that's one of the benefits of being part of a larger group. We can offer those types of opportunities to our therapists.
Yeah. Cool. And
Any other questions?
Yeah, what's kind of as well the opportunities to move up within the company? Starting from the bottom, obviously you're going to put your time in. But
Right. Yeah. And bearing that in mind, it's sort of important to emphasize sort of that team dynamic. So we certainly look for people to take sort of charge or take some leadership within their departments. So that's absolutely something we pay a lot of attention to.
And just one last one.
Mm-hmm.
Doing a lot of team-oriented sports in college.
Yeah.
Is there any opportunities where you guys kind of do team building stuff?
Oh, absolutely. Yeah. Well, particularly with the pediatric population, we really emphasize patient-centered care, and that requires integrating lots of different disciplines together. So you'll be working on a daily basis with physicians and surgeons and occupational therapists and speech therapists as well. So we really try to foster that team dynamic.
Awesome. Yeah, thank you so much for having me today.
You're very welcome.
Is there anywhere I could get a business card?
Absolutely. Yeah, we'll grab that for
Awesome.
you.
Yeah. Thank you so much.
You're very welcome. Have a great day.